Hello. 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 Good morning, everyone. I welcome you all on behalf of BSS in this Gujasicon. Today we'll be talking on how to prepare for NEET SS. So let us start. I'll first introduce myself. I am Dr. Shivang. I am an assistant professor in surgical oncology at Baroda Medical College. I did my MBBS from Baroda Medical College. After that, I got a rank of 583, where I took up general surgery at JJ Coop Hospitals. And thereafter, I got a rank of 35 and I took up surgical oncology at GCRI at PJ Medical College. So, like you all, I also had to face similar struggles. We had hectic night duties during our residency. We had a very vast syllabus and a very limited time. But few years back, I was on the other side of this table. I was as a surgical resident as you are, and I was hearing everyone at conferences how to prepare for NEET SS. Now I am on this side. So with the right approach, I am sure you all can also crack NEET. First, let us understand what NEET SS actually is. So NEET SS, during our time, we had one core specialty which was general surgery, and we had to take up two other super specialties. So I had taken up surgical oncology and plastic surgery. We had to give 40 questions of general surgery, and we had 60 questions of the specific specialty which we took. So 60 questions of surgical oncology and 60 questions of plastic surgery. But now the pattern has changed. Now it's only the syllabus is only general surgery, and it includes 12 other super specialties. So you have to read, I think you have to have an overview of all the super specialties. And the syllabus is actually very vast. We cannot go through all the 12 super specialties. So the point is we have to be smart and we have to do selective reading so as to crack the exam. As general surgery residency, we have a few struggles. Like we have our residency is usually overworked. So I feel the best time to prepare for NEET SS is during the second year. You can start during the second year when you usually have your DRP postings, and there are periphery postings. So that is, I think, we have adequate time on your hand to start preparing for this exam. There is vast syllabus. We have to prepare for our practical exams, our MS theory exams, as well as NEET. So it is very important to prioritize. There is always problem of plenty. We have so many resources available, so many apps, so many books. So which resource to pick is again a very tedious thing. And fatigue and burnout is another problem during our residency. So this is what my strategy was when I was doing general surgery. Ours was a COVID batch. So my third year in general surgery, we had COVID epidemic and we had COVID duty. So I actually started my preparation during third year of my MS, and I had 4 odd months before the NEET SS exam. I started my preparation from June, and our exam was in September, 15th of September to be specific. So from then on, I gave daily 6 hours of reading the last few months of exam. I think the key is to make a proper timetable. You should have a proper timetable in your hand for preparing for such an exam. And your timetable, you should break it down into days. Like you can give a specific section for a day. Like I'll cover GIT today, I'll cover GUT tomorrow, then breast and endocrine on the third day. So it has to be, the timetable has to be very structured, and you can then have weeks, like in 1 week you will finish 2 sections, in the next week you will finish another 2 sections, and it is very important to have a buffer day. I always kept a buffer day because I knew that some of the topics I would miss during my timetable, and so I do not get overstressed. I used to keep a buffer day, then finish this on the buffer. It is important to prepare a good timetable. At the end, when you have finished your syllabus before the exam, in order to crack it, I feel you have to complete the entire syllabus minimum 7 to 8 times in order to crack the exam. Minimum 7 to 8 times of thorough reading of all the resources is a must. And how to revise it? So initially, I had made 1 week revision time for revising the entire syllabus. So during my time, it was general surgery plus surgical oncology as a specialty. So I had to finish everything in 1 week. And in subsequent revisions, I shortened it to 3 days. 3 days I used to finish my general surgery as well as surgical oncology, PD, Savistton, whatever resources I have. So this is the revision is the key. I did a smart trick during my MS. We had feeder specialties which we had to cover like ENT, orthogynec. So I went back to my UG notes, DAMs, and that really helped me in few of my MCQs. So the trick is to do smart reading rather than to just open up all the textbooks again and go through them. There has to be a balance between books, MCQs, guidelines, and all the apps. And no distraction is very important. Go off your social media, stop everything, because whatever drop year you have is just going to increase your number of years where you will finish your entire training. So try to minimize your drop years. It is a very important exam and you should take it seriously. These are certain high-end resources which I feel will hold true even if the exam pattern changes. So Bailey from first to last page is a must. Savistton, since I had less time on my hands, I completely, the GI part, I did it very thoroughly from Savistton. Schwartz, I always recommend breast, uro and endocrine from Schwartz. The Schwartz beautifully describes these topics. Bailey, it is very important to do the figures and tables. Like for example, I remember there is a table of pancreatic embryogenesis where it says the ventral bud maybe appears at so and so weeks during embryogenesis, dorsal bud at so and so weeks. So they can always pick up one-liners from those tables. Super specialty books for me is a complete no. Even today, you will never have the time to go through all the super specialty books because you have to remember you are a MS candidate, you are not an MCH candidate, and you have to limit your resources if you have to crack the exam. You cannot just go on reading all the super specialty textbooks because you will not have the time to revise, nor you will understand those books. So do not go through any of the super specialty books. Instead, the trick is to take the use of different apps. For example, I used to use Speed app, and I used to make handwritten notes from the app. I used to see a topic, I used to make my own handwritten notes, and then I only used to revise those notes. Another important thing is you can appear for topic-wise, and the topic-wise tests and grant tests from the apps can be used. And in the era of digital apps, like we have everything available digitally, I would still prefer handwritten notes because your visual memory, you remember, will always come from your handwritten notes. No matter how much you go on the digital apps, you read through the digital apps, but during the exam when you have to recollect, it will always be the handwritten notes or the textbooks from which you will be able to recall those sentences. So handwritten notes and textbooks are underrated in this era. Do not extensively go through any guidelines like NCCN, this is for surgical oncology especially. So you need not go through any of these guidelines. MCQ banks and previous year papers will help you. And you can always get in touch with my notes. I have notes of surgical oncology and general surgery which I made then. So if anyone of you is interested, I can share. These are certain smart study techniques. So my aim here is to develop a mindset through which you can prepare for your NEET SS. I will not give you this topic from that book, this topic from that book, but you have to have your own mindset and you have to have your own strategy because everyone will have a different strategy of preparation. My strategy will not help you. But you have to develop a mindset where you develop your own strategy and you are confident enough that this is going to work for me. So when you make concise notes of the apps, there has to be an active recall for those notes. For example, you have seen a video, then you have made up the notes, you have to memorize the notes, and next time you just need to memorize the page, the entire page. You should be able to recall the entire page on the day of exam in order to crack that MCQ. For like Bailey textbook, what I had done was I had marked my entire Bailey textbook with MCQs. Every line had a small Q on top of it stating that this line can be a potential MCQ. So when you read Bailey, you have to think that this can be a potential MCQ in the exam. You have to have the mind of an examiner who is going to make the paper from Bailey, because the examiners are going to be general surgeons. They will not be making, a lot of questions will not come from their super specialty books. most of the questions will be from your standard general surgery books. Like for example, cholecystitis, I think there is a classification. What is the classification of cholecystitis? Tokyo classification, right? So then they might just ask you a question कि कितना WBC के ऊपर that cholecystitis में है, तो 16,000, 18,000, 19,000. The answer might be 18,000. But for that you have to remember that this was given in really early age. Because in the exam what will happen is you will not have time to recall. Your recall has to be in split seconds. You see the MCQ, you have to memorize, recall the page, and you have to attempt the question. Otherwise, you will be lagging on time. Another wise thing to use is, we all use electronic media, but we have to use it wisely. For most of the tablets have an option of split screen. So on one screen you should have your video running, and on the other screen you can have any note-taking app like GoodNotes or Notability, any of the applications. You can just take a screenshot. If someone is presenting a video, there is going to be a slide behind that video. You can just take screenshot of that slide, copy paste in your GoodNotes app, and that becomes a concise material for your future revisions. Group discussions are very important. You can tell your colleague to read a topic, you can read a topic, and then you can discuss. Go through the past papers. You will know what all important topics are there for the exam. Depth should be in the topics which are very, very important for the exam. Otherwise, you should have an overview of all the topics. And yes, exercise is one really underrated thing. What I did in my MS was, before starting my day, I used to have 1 hour of vigorous exercise, and then I used to study for straight 4-5 hours. But that 4-5 hours actually helped me to have an effective study of 6 to 8 hours. So I feel exercise is actually very underrated, and you should have time where you spare in your daily routine for some or the other. How to go about applications? There are numerous applications available. There is Speed, there is LGS, Speed, Marrow, DAMS. Everyone I think has a super specialty course. So here, do not watch videos again and again. Once you watch the video, you should have concise notes, and then you only have to revise through the concise notes. Watching a video again and again, you will not be able to recall in the exam. We have to remember that our end point of doing a topic is that we should be able to recollect it in our exam. If we cannot recollect it, then there is no point of going through that topic. Take topic-wise tests. Once you have covered a particular topic, take grand tests, and this is very, very important. If you have attempted a question which is wrong in your grand test, what I used to do is I used to take a screenshot of it and I used to put it in a separate folder. Because it is our tendency, if we are attempting a question wrong initially, if the question is repeated in the exam, we'll attempt it wrong. That is our human tendency. We need to correct it. And in order to correct it, you have to revise. This question I attempted, this was the wrong option which was ticked, but this is the right option. Because your brain will start thinking in the first, whatever you have attempted first, you will again think in the same manner. So that needs to be corrected. So take all the screenshots of the wrong questions and keep it in a separate folder. Any question which you attempt wrong in any of the apps, they will definitely give you a page reference and they will give you the theory which is quoted. But that, do not rely solely on it. Go back to your source. Go back to BT, go back to Suggest, and open up that page, because sometimes that app may be wrong. You cannot solely rely on the app, you have to rely on the basic textbook. So go back to it, again read the entire topic, and then think what went wrong when you were solving it. This will also help you in improving your visual memory. So grand tests, I recommend a minimum of 5 to 6 grand tests before you appear for your NEET exam. And every week you should give one grand test every week. And then on your subsequent grand tests, always compare with yourself. Your percentiles have to improve. If your percentiles are not improving, it means you are doing something grossly wrong. So review what wrong, what incorrect thing, or your study material, or is it your study technique, something is wrong. Review it, improve it, but your subsequent grand tests you have to improve on your percentiles. This will also give you a very good boost before your exams. And the folder which you had made where you were appearing for the grand tests, all the wrong questions, review it one day before the NEET SS. I had 2-3 questions directly coming from this folder in my NEET SS, and I was able to mark them correctly. So how can you use residency as a preparation for your NEET SS? So whenever you have OT ward cases, always try to correlate with theory. For example, if there is a patient of fistula which is getting operated, you should remember what is the classification of fistula, which is the most common type of fistula, what are complex fistulas, anterior fistulas, posterior fistulas. Everything should be in your mind, at the back of your mind when such cases going on the OT or it has been discussed. For example, pancreatic cirrhosis, you should be able to recollect in a 6 millimeter thickness चाहिए if you want to do a cystogastroscopy or a pancreaticogastroscopy, whatever. Each case is a potential exam question, because if you have this mindset, then only you will be able to recollect all the topics in your exams, and always make someone your mentor. During my MS, I had a senior whom I used to constantly ask him how to prepare, what sources to read, how did you go about it, because we all are confused in general surgery कि कैसे prepare करना है, ये पढ़ना चाहिए नहीं पढ़ना चाहिए. Always keep someone as your mentor, it really helps. The day before the exam is very, very important. Calm your nerves, do not panic, have adequate sleep, exercise if you are stressed. Keep two things for last day. Keep figures and statistics, make a separate folder of figures and statistics, revise it before, one day before your exam, and all the incorrect questions which you've done in topic-wise tests or in grand tests, revise them just one day before the exam. 2 weeks before the exam, no new sources, because you will not be able to recollect it. Frankly, if there is a question, you have read a new source, it comes in the exam, you will anyways not recollect it. Better to not waste time. Do not read any new sources there. On the exam day, there are 3 sections. I think Dr. Ruchir is more updated with it, but there are 3 sections currently. Each section is of 50 marks, 50 questions, and we have 150 minutes. So it is 1 minute, 3 sections, 3 sections, and 50 questions for one section, and 150 minutes for the exam. So basically, you will only have 1 minute for each question. So you have to keep that in mind during your exam. Attempt all the questions which you know on your spinal level. You just finish it in the first attempt. Any question which is taking more than 1.5 minutes, review it, skip to the next question. When you feel there is a very, very rare question, like there is a surgical oncology question on some mutation which you have not read, there is a very high probability that 99% of the students wouldn't have read it. Don't waste time on those questions. It is very important. Just skip it, because if you don't know it, nobody else will know it. At the end, it's a game of percentiles. So if no one else knows it, then it's not that this question is going to decrease your percentile score. Now, how many questions to attempt? So we had 100 questions in total. I had attempted 96 questions during my NEET SS. So I think out of 150, minimum 140 to 145 should be your target in order to fetch a good rank. Mistakes to avoid. Reading too many resources where there is no scope of, when you pick up a resource, just think this, that will I be able to revise this before the exam? And if you feel you will not be able to revise it, do not touch that resource. It is a waste of time. Rather than pick up a resource where you will be able to revise it. Always do MCQ practice, because that is what is going to help. Last minute panic cramming is not going to help. You will be utterly confused during the exam in all the MCQs. You will not be able to pick up the right MCQ. And do not compromise on your sleep, health or mental health. So beyond the rank, I chose surgical oncology because it was my passion, and I always feel this is where I am going to give an impact on the community. Super specialty training is always a lifelong training. It does not end when we start MCH. And because of a strong foundation of MS, I was also able to clear my MRCS after my MCH. So a strong foundation of MS is important, and it always takes you to a long way. So the final takeaways of this session is, as I told you before, I am here to tell you to develop a mindset where you can make a strategy and you can give your exam. So consistency is always going to be more than intensity. 1 day of 12 hours of reading is of no use. Every day of 4 hours of reading will fetch you a good result at the end. 1 day reading 10 hours, next 12 hours, third day 12 hours, and 3 days of no reading is not going to help. Focus on quality rather than quantity. Make concise notes and focus on them. Make a smart strategy, because everyone will have 3 years for preparation. There is a fixed time every candidate will get, and then you have to appear for your exams. So you have to be smart when you are reading for your NEET SS, and you have to trust in yourself that whatever I am doing is going to work for me. A good MS foundation will always lay the founding blocks of super specialty and as always vice versa. Do not skip your MS for preparation of NEET SS. This is a very bad trend which I am seeing in Baroda Medical College, that most of the students just want to prepare for SS and they don't want to take MS seriously. They do not read and come for the theatre, they just read for SS. This is a very, very bad trend, please avoid it. And I open the floor for questions. If you have any questions, you can let me know. Any questions for any source related questions or anything, you can let me know. I was a faculty at Speed after I finished my MS. They had approached me, and I think I have my few videos there. They still have my few videos on a lot of topics on the app. You can go through that, or you can also ask for my notes. I'll be happy to share. And if there's any question, you can let me know.